Good day, ladies and gentlemen. Welcome to Best Life Health Show with Dr. Best Life. Today, we are going to look at a very important topic, which is the role of physiotherapy in community-based rehabilitation in primary healthcare services. And we have a very special guest who is well grounded in the field of community-based rehabilitation by name Dr. Mfonobon Odo, PT. Welcome back to the show.
Thank you so much.
Dr. Mfonobon is the National General Secretary of Nigerian Society of Physiotherapy. She's also the head of unit surgery and community-based rehabilitation units with the University of Uyo Teaching Hospital. She's also an associate faculty of community-based physiotherapy postgraduate physiotherapy college. So you can see we have an expert in this field to do justice to this topic. So without wasting much of our time, we would like to ask you, Ma, who is a community-based physiotherapist or a physiotherapist who specializes in primary care services?
Okay, thank you so much for having me and welcome our viewers. So a community physiotherapist is a specialist, just like the host has said, who has acquired additional knowledge apart from the basic undergraduate training, basic physiotherapy undergraduate training from the university. They've gone ahead to acquire additional postgraduate knowledge that enhances their competences in delivering community-based physiotherapy. So just like we have neurophysiotherapists, orthopedic physiotherapists, sports physiotherapists, we also have community-based physiotherapists. They are specialists, so it's not just anybody who is doing the work. They've acquired additional skills, additional competencies that enables them. They understand the rudiments of delivering rehabilitation services in the remote area, and they have been equipped with the tools to do so. So that is, in a nutshell, a community physiotherapist.
Oh, that's great, and I believe it's clear enough. I know that there is this call to make this call by the World Health Organization to make physiotherapy rehabilitation accessible to people at the grassroots, the communities.
Yes.
So, and I believe that this is a very good move to make physiotherapy available to these people in the community. And I believe community physiotherapists has a lot to offer. So I would like to know, what are their roles? What are the roles of these specialist physiotherapists in primary care health services? Can we know some of their roles?
Okay, so to just make our audience understand, so we have, when we say rehabilitation services, they are a broad scope. Physiotherapy is one of them, and today we're talking about physiotherapy. So I'll stay with physiotherapy. To talk about the role of a community physiotherapist, in simple words, they take these skilled physiotherapy services that is mostly centered in the urban locations. They take it to the rural community.
Okay.
Why do they have to do this? Because we have a lot of people that are disabled. They have people that have stroke, have cerebral palsy, have orthopedic conditions like arthritis and all that. Our aging population in the remote location, in the remote communities who don't have access to physiotherapy services that are mostly centered in the urban locations. So the community physiotherapist working in the primary healthcare center is situated within the community, so that the people who have these ailments and even more that I haven't mentioned, they can have easy access to quality and affordable physiotherapy services. Now, this is basically their role, and they see a whole lot of conditions as long as these conditions reside in the community or in the remote
okay, thank you so much. There is this saying that, or rather it's not a saying, that in the community there is always problem with resources, health resources. What I mean by equipment, facilities to intervene in certain conditions. So these physiotherapists, are they also trained to use the available resources within the community? When they go to those community and they meet up with challenges of lack of facilities, are they trained to fit in, to find a way to attend to those patients that has one form of disability or the other? I know in the community we have people with a lot of disability. They can't move, and they can't even afford crutches, or even the crutches might not even be available in those. I'm talking about the rural areas, rural communities. So how equipped are they, skill wise, in attending to those, group of patients?
Okay, so I'll start by saying that a physiotherapist is a mobile clinic.
Okay.
So as you see me, I'm a clinic. The clinic that I am is that I use my hands first and foremost before any equipment. So a physiotherapist who is working in the remote communities, they are not disadvantaged in any way because they themselves, they are already a walking or mobile clinic.